Estrogen dominance can result in a disease called polycystic ovarian syndrome. And I want to go over some of the reasons for it and what takes place, but I will provide a resolution at the end of this video. Polycystic ovarian syndrome, or androgen excess, as some of the doctors call it, which is very descriptive actually. It really is a metabolic disorder, which means it is greatly affected by what we eat, what we put into our mouth. It's also an endocrine disorder. It means that the endocrine glands are not responding properly. We know that it is associated with insulin resistance and produces symptoms of acne, increased facial hair, male pattern balding, and certainly an irregular menstrual cycle, which results in fertility issues. And what happens is when a woman goes to pop an egg, the egg doesn't pop. It doesn't leave the ovary, it produces a cyst. And if that happens every single month, then she develops quite cysty ovaries. Now, every time the egg doesn't pop, means that progesterone is not produced. Certainly estrogen continues to be produced, but progesterone is not produced. And so that is what creates the estrogen dominant position. In addition to that, women with PCOS often have insulin resistance. Well, what does that mean? That means that there is too much circulating insulin in the body. That will immediately cause testosterone levels to continue to rise. And that's why some of the doctors call PCOS androgen excess or androgen dominance. The way to resolve PCOS is to start with a saliva test to find out where your androgen hormones are, where your estrogen is. Do you have low progesterone? The lab will give a diagnosis of PCOS if that's there. And if you have been diagnosed with PCOS, very important to start with a saliva test. The second step is to reevaluate both their nutrition program and their supplement program. So nutrition-wise, they're going to have to focus on fewer carbs, adequate protein, elevate the fats in their diet. Supplementally, you're going to want to look at some indoles, cruciferous vegetables, supplements that contain I3C and DIM would be very important to modulate estrogen levels. It would be very important to consider short-term progesterone therapy. Bioidentical hormone therapy would be important. It would be important to address two nutrients that are important for the adrenal glands. One would be vitamin C, increase the amount of vitamin C, and increase the amount of vitamin D3 in the diet. We know that D3 is definitely a supplement that women with PCOS should have. Another nutrient that's very important in the resolution of PCOS would be L-arginine. L-arginine will increase blood flow to the ovaries. And oftentimes with women with PCOS, the blood flow has not been circulating well to the ovary. So using a good quality L-arginine supplement, and we'll put a link in the description below for a good L-arginine product, but L-arginine becomes very important to improve blood flow and resolve polycystic ovarian syndrome. Taking these supplements is going to address sort of holes in the diet, but more importantly, it's going to give the body adequate tools to work with. And I think that's very important when resolving the issue of PCOS, because we know that PCOS is centered around insulin resistance. Then we know that too much sugar, too many carbs, high insulin is going to usually result in elevated testosterone for those women. Now, we see this in women who are childbearing age for PCOS, but we also see it in women who are in menopause. And so it's important to correct this as early as you find out that it is evolving. All of these hormone imbalances, including PCOS, can be resolved, and women can be fertile again. It's an easy correct. You just have to know how to begin. Start with a saliva test, move forward with your diet, get some help with some supplementation, get on a program to resolve your hormones, and it will resolve relatively easily.